Medica Super Speciality Hospital. When a breast cancer patient comes to us, they always have a question like what are the relevant tests, what test we need to do to understand whether it's cancer, what is the stage of the cancer. Stage is a very important question that they have in mind. There are few tests which are basic, which helps us to understand what is the size of the tumor and what kind of cancer it is, what kind of breast cancer it is. Because breast cancer can be of different types. So the two basic tests, which is the first step at the diagnosis of the breast cancer, is a mammogram, which is the X-ray of the breast. It's just like an X-ray of the breast actually. So a mammogram helps us to see the extent of the tumor, what is the size of the tumor, how much it has spread to the breast. It talks only about the breast. It does not tell us whether the cancer has spread to any other part of the body or not. Along with the mammogram, we also do an ultrasound of the breast and of the underarms area. It helps us to understand the shape, the type of the tumor it is, and whether the cancer has spread to the underarms area. Every cancer has a tendency to spread, right? So breast cancer, when it spreads, it goes to the underarms area, or what we call as axilla. So when it goes to the axilla, we say that it has gone just beyond the local area and it is in the point of spreading. So if we see there is any evidence of cancer in the underarms area, then we might ask the patient to get something of a higher degree test, which is known as a PET scan. Okay, more about that. So the next step in the form of diagnosis would be a biopsy. So a lot of patients ask us what is the difference between a biopsy and an FNSE. FNSE is also known as fine needle aspiration cytology, and a biopsy is just biopsy. So the biopsy involves taking a larger tissue, and FNSE is just taking out cells to study under the microscope. So they both tell us whether it's cancer or not, whether we are dealing with cancer or not. But a biopsy helps us to tell what type of cancer it is and what is the grade of the tumor. A cancer has grades, and it can help us to tell what is the grade of the tumor. And breast cancer has various types like ER positive, HER2 positive, triple negative, and these can be determined, and these can be understood by a biopsy report, which cannot, and this information is not given to us by FNSE report. So if we are pricking a patient, if we are taking out a tissue, it is always advised to do a biopsy. FNSE, a lot of people still do FNSE, but according to all national guidelines and all cancer protocols, biopsy is the standard treatment, a standard test to be followed. So it is our request to tell all our fellow practitioners to advise a patient biopsy and not FNSE when advising a test for cancer diagnosis.